Now, I did this. Why can't you? Why?
The Dark Lord Greg has arrived.
Why?
Cassidy might need to be on Unboxed tonight. Yeah, probably.
Which Cassidy?
Bill Cassidy, Senator.
Oh, did he light him up?
Oh, yeah. He was like, I'm a doctor, and I don't think what you're doing is correct.
Chrissy. Oh, whip it up. Bella. Hit like and subscribe. The best network, the greatest network. They do. Oh, I'm doing the right ways. The best network, the greatest network. They do a good job. Thank you for your attention to this matter. The BinPodcast Network.
I think everyone should just end their tweets or their. I'm gonna start ending emails with thank you for your attention to this matter. It sounds hilarious.
It's on the bottom of the Declaration of Independence.
It's the last line of the Constitution.
Inalienable rights, blah blah blah. Thank you for your attention to this matter.
You know what? If Trump was to I want to amend the Constitution so that at the end it says thank you for your attention to this matter.
Love Donald Trump.
Love Donald Trump. I'd be like, I'd vote for that amendment.
You know what, Tim? When we have to form a new country, oh damn, she's livid. Look at Bernie. Oh, we're gonna turn on the audio and do that shit.
Yeah, Bernie's gonna be next. Well,
so
after some Republican.
Like, damn, we might have to break with the banter here because I want to know what she just said.
Yeah, let's go back and Senator because Bernie's lighting him up too. Jesus.
Ooh. Oh boy. All right, we'll start.
Ooh, it's fight. Ooh, this is gonna be a good unbox tonight.
Oh, so we're gonna have a good show tonight, baby. No pineapple for us, baby.
Answer those questions. That is malpractice at these agencies, and that is the malpractice that I am going to fix.
Thank you.
Thank you. Senator Warren.
Here we go.
Third war in the hedge.
Last November, while you were under consideration to become Secretary of Health and Human Services,
oh, it's bugs.
Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them.
Unbelievable.
Then last week, you announced the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children
Mike, you turn it up slightly.
Age are eligible to get a COVID booster at their local pharmacy today?
Yeah.
Anybody can get the booster.
Enhance. I have the technology.
We can rebuild him.
Anybody can get it.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
That is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
No, I didn't. I never promised that I was going to recommend products with which there is no indication.
When you said,
oh boy,
$55,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
You want me to indicate a product for which there is no clinical data?
Senator,
Is that what you want?
Secretary Kennedy,
What a
you said you
fucking
wouldn't.
lie.
Yeah, wow.
Right.
There's
Everybody can
tons of clinical data.
No,
They had mad trials, bro, just because you don't understand how science works, because you're not fucking trained in science.
Right.
You're a lawyer.
An environmental lawyer. That has nothing to do with fucking doctors.
What are you talking about?
they can't
Oh,
walk
boy.
into a pharmacy the way they could last month and get access.
It
to a
depends on the
vaccine.
it depends on the
It
states.
depends. A year ago,
But they can
it
still
did
get
not
it.
depend.
Everybody
A
can get
month
it.
ago, it did
Everybody
not
can
depend.
get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well?
Motley
even though
says,
you
I'm
promised
unable
not
to manage my own money
As I
slash
said,
funds.
I'm not taking
Grab a job
vaccines away from anybody.
National
If they-
Treasury.
Same answer, right?
You're
just gonna
overqualified,
deny
actually.
when people can't get access,
You once
that you're
had
not
an account.
taking it away. Then let
You've
me
been
ask you,
bankrupt,
is
you're
the same game
hired.
you're gonna play with
Well, you want me to-
measles,
so
mumps,
you-
We only need people who've never had a bank account to run our national treasury.
For our Treasury Secretary, we want someone who hides their money under the mattress, thinking that that's
Correct.
the safest place for it.
Gold bullion in the backyard. Fucking treasure map.
You have a cellar dug out in your backyard specifically for gold bars. That's who we want for Treasury Secretary.
Next to a pallet of Twinkies.
I'm going to recommend every product in the world so that without
I'll
any
be king
clinical
when it all
trial
falls
data.
through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can
into a
still get
pharmacy.
COVID vaccines,
You are
Senator.
taking that away.
No, you are
So
still.
let
You
me
can
ask
still
you
get the
one more
COVID vaccines, and
question,
Medicare
Secretary
will still
Kennedy.
pay for them, and Medicaid
Did you
will still
tell the
pay.
head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, "Are you a trustworthy person?" And she said no. So if you had an employee who told you they weren't trustworthy, would you
What the
ask them to resign, Senator?
What?
So I'm sorry, but this is not what she has said publicly. She has
Well,
said.
I'm
she
not
was
surprised about that.
pre-approved. So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get this
witnesses.
straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full
Brother,
confidence
this
in
Oh,
is
her.
a
boy.
public
That you had full
execution.
Oh my
confidence.
God.
We're gonna have to blur
Credentials.
this out.
And now that she became a liar?
Yeah, you should ask
We're gonna have
her
to
to
censor
change.
this.
And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree
because
with
I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting American babies'
Oh,
health
man.
at risk, American seniors'
Elizabeth Warren
health
doesn't
at
fuck
risk,
around.
all Americans' health at risk, and you should resign.
Senator Sanders.
Oh, Senator Sanders is next. Great. Great.
Just want to pick up on Senator Warren's point. Are you telling us
Pick 'em
that
up.
the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
Wow.
Having a quote.
I-
And I asked her
no,
twice.
one second. And you're also repeating now that she is a liar, correct? What you wrote in the Wall Street
If
Journal.
she wrote that I fired her because she refused to sign on in advance for the ASIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Help Committee, maybe this committee
Call
as
her
well.
up. Yo, call her.
All right, Mr. Secretary, I've got a bunch of questions.
Crosstown.
Appreciate
Get over
brevity
here
in
in 20
answering it. So-called beautiful
burn me
bill
down.
threw 15 million Americans off of health care,
Damn.
substantially raised premiums, and is going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, it's not really making America healthy again.
It's going to have it.
Where we're
It's
at
going
right now?
to be the biggest infusion of
like
federal
when you said that
dollars
word.
into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern day medicine that saved tens of millions of lives.
Yo, I totally forgot that Trump was over here bragging about the COVID vaccine coming out. I totally forgot that he took credit for that.
Yeah, Operation
His-
Warp Speed. It was all his
Operation
idea.
Warp Speed was his idea. Only he could pump it. I was pumping out vaccines like no one else had seen in the all other pandemics failed in comparison, and I just was pumping them out. I was just pumping them out. He was bragging. I forgot all about that. The fact that he bragged about his vaccines, and here is RFK Jr. in charge. Oh, I forgot.
He
gloated.
said that it was a modern day miracle. A modern day miracle that he got them COVID vaccines out.
And he sent them straight to Vladimir. He's like, "Are you okay? Did you get the masks I sent? Okay. You stay safe."
Worldwide, scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right? Or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. Oh, I said that in terms of there's reports.
He's got RFK twisted up in
I
knots.
said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine, which perfectly matched the virus that was circulating then, and I have no idea how many lives it saved, but it saved quite a few.
Oh my
You know what I
goodness.
find a little bit weird in this discussion? I'm hearing it over and over again.
Yo, what is his plan? He is like, he is a fucking long-tailed cat in a room full of rocking chairs. Like, he is fucked. Oh man.
He's acting like a petulant child too. He's like sitting back in his chair and just fucking trying to yell at these people who are just ruining him.
Does he have like the fucking, he's like doing this shit and fucking doing like, like, are you fucking rolling right now, guy? Like, are you know what I mean? Like the fucking world, like someone's tilting the room on him and shit. Like, he's like uncomfortable in his own balance right now.
That's because he's getting fucked up.
He did a double fucking walking into this. He's like, espresso.
He's just getting Tiger Mead over and over.
You said espresso, fucking raw milk, fucking raw milk. Let's do this. Oh boy, let me see what my manager wants.
This morning, Mr. Chairman, we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors.
Dr. Oz.
I'm giving you the
Not
name.
a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment. which has been co-opted by the
Oh,
pharmaceutical
hold on. So
industry.
you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And I'm
the
telling you,
American Academy of Pediatrics, the American, and by the way, just
Hold on.
Mikey, you need to go back like 30 seconds because it gets fucking wild.
Y'all, you know what she wanted? She took her socks off and couldn't get them back on.
I mean, I often feel that rage.
Don't take them off. She had them both like in opposite sides of the thing. And she was like, she had one. She's like, it doesn't go back on, man.
Hey, how do you do this? I have no idea what's going on here.
Yo, it broke. Like, what's wrong with this thing? All right, I'll go back 30 seconds to say. I'll do
30 seconds.
for the record.
The primary advisors are already
Go back a few more. Go back a few more because you got to get Bernie's question here.
and I have no idea how many lives it saved, but it saved quite a few.
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are who are the organizations that are
Wait till
agreeing
you
with
hear
you?
this murderer's row.
Casting aspersions on vaccines.
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving
Dr.
you
Oz.
Few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical
hold on. So you're telling the American people.
He sound like a televangelist. You talking about the evolution of man. You need to be talking about man's evolution. Fucking boy, shut your ass up. Oh, man. Get him, Burn.
That the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And I'm
the
telling you,
American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food.
Everybody but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president. You got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. But I think the issue
I
now.
don't even know what you're talking about.
Well, I think you do.
God
I
damn.
don't even know what you're talking about.
The issue is every time anyone
Are you saying
disagrees with
are
you.
you saying the pharmaceutical industry was supporting my presidential
No,
campaign?
I'm saying
I don't think
no.
so.
I'm not saying that. I'm saying the pharmaceutical.
How, boy.
Come
You know,
on, RFK. You know what he said.
obstinate child.
You know what he said.
You know exactly what he said. Punk ass.
Listen, I don't like that the pharmaceutical industry gives to every fucking politician they can get their hands on. However, that does not make those politicians specifically corrupt, right?
Well, no, according to him, they are corrupt. Fine. I'm
Right.
with him. I'm taking your logic, RFK Jr. They are corrupt. So why are you with all of these corrupt people?
Yeah, I think that's the point that Bernie was making is like if
Yeah.
Donald Trump takes money from the pharmaceutical industry, doesn't that make him corrupt too? Doesn't it make all the
Yeah.
Republicans on that dais corrupt?
Why don't you say that to Marco Rubio? Say that to Cruz. Get all up in your best buddies. Say that to Oz.
Say that to your
say
fucking
that to all
best
your
friend,
best
Dr.
friends.
Oz.
Yeah. Say it. Go tell Dr. Phil.
Industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the
It's not,
American people.
listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya.
That's not good.
Yeah, you shouldn't be fucking doing that, bro.
Y'all
should be
should
arguing.
know.
You should be arguing with the doctors, telling them what they don't know. Like, come on.
We have arguments every day about whether or not the earth is flat. Like, fuck.
We have arguments every day about whether or not you should leave dead bears in Central Park. Like,
Yo, the water cooler in that office must be crazy. The scuttlebutt must be straight up queuing
can't
up,
wait.
like Iota Anon or something. Like they're on some other shit.
I
Next
can't wait
level
for
shit.
the books, the tell-all books to be written about RFK Jr.'s Health and Human Services Department.
There's gonna be like a 7-part mini doc. Oh man, 60 Minutes is gonna be back with a fury after the television coup.
With Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Senator Tillis.
Thank you, Mr. Chair. Secretary Kennedy, thank you for being here. You a couple of times you asked people if they were making a statement or a question. What I think I may do, just to give you a breather, is to make a statement with a lot of questions. And just for the record, I'd like for you to have the opportunity to have your staff respond. I can't conclude from the discussion today where you are on warp speed. So I would like the definitive statement.
Another Republican?
On exactly where you are. Was it good? Was it bad? Were the things that worked? Were the things that didn't work? I can't
Tillis is
discern
grilling
that.
now?
What you said here, I for one
What
think
is happening?
it was a signature accomplishment of
It's
President Trump and the
crumbling,
mRNA
It's
platform. Is
crumbling.
something
I agree with
that's
that.
I look forward to you giving us a detailed statement on
What a
exactly
world,
where you
what a
are with
world, what a
warp
world.
speed. I'm not a doctor. I'm not a trial lawyer. I'm a boring management consultant. Another question that we'll
That is
submit in the
boring.
record, I'll give you
It's pretty
direction to where we're going. I don't see how you go over 4 weeks from
Okay.
a public health expert with unimpeachable scientific credentials, a long time
Shit, bro.
values,
Everyone's dunking on him.
passionate and brilliant
You got Bernie's
microbiologist, and
notes.
4 weeks
He said, let me
later,
see that burn.
fired
Burn
her
dog. Let me
because
see that
at least
paper.
the public reports say because she refused to fire people that work for her. So as somebody who advised executives on hiring strategies, number one, I would suggest in the interview, you ask them if they're truthful rather than 4 weeks after we took the time of the U.S. Senate to confirm the
Oh,
person.
shit.
Future.
He said, stop wasting our time.
Consider.
If you're over here still vetting people,
But
you already
I do
confirmed them,
also
motherfucker.
believe that some of your statements
That's a
seem to
good point.
contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that. And I'm sure that you will have some. You will do nothing that
What have
makes
you
it
been doing at
difficult or
work?
discourages people from taking vaccines. There seem to be several reports that would seem to refute that, but I'd rather you just respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of
You activated my trap card.
firing advisory board
wait,
members, attempting to stall NIH.
You triggered my trap card.
Funding for the, I think $500 million for further mRNA research, and just want an answer for it. On HR.
No one believed me. I told you, you can't sell this shit. That all these motherfuckers have to go home. And you see how rowdy
Yeah.
it's been. Those meetings are usually empty. Maybe 10 people that are like part of the posse. Hundreds of people at those are a huge anomaly. The tide, it shifts.
One, I believe, you know my.
So good on you, all you town hall meeting people, and all of you press conference people. It's
Yo,
working.
Trump might fire this guy.
He might be out of here, yo. He'll let fucking Marco Rubio do
Concerns
it.
about HR1. I've had several meetings with, and HR1 is the big, beautiful bill, OB3, whatever the brand is. But I'm still, I've got an office with 60 staff, including half of them in state office. I've had 3 different estimates of the economic impact on the state of North Carolina. Can I get your commit? And I have been looking for somebody that's far more resourced than an office of 30 people up in here in DC to disprove my estimates with respect to the impact on North Carolina, period. And I've yet to have anybody. I would love to be embarrassed and be wrong, but I would like to get your commitment for people to tease through the numbers that I provided before the vote.
Yeah. Person impersonator says, yeah, hats off to the American folks showing that there is a line you cannot cross without pushback. And once that Elon money is no longer a factor, it's just the old pitchforks and torches now. And
Yeah,
it's like,
man.
oh shit. Oh shit. He was bluffing, but the people are still mad.
On HR1 that says that if you normalize 3 independent estimates across a broad spectrum, $25 billion over 10 years. I don't need your response now. I want somebody to destroy my estimates, because to this point, the most resourced health agency in the world has only given me word salad responses, and I need that so that we can prepare for the response. $25 billion over 10 years is half of the
He said you ain't done nothing, bro.
in 5 years. And so we just need to have that fact as a matter of policy,
if he had access
so that
to
we
all
can
that
go
money.
in North Carolina and
Oh,
absorb
boy.
it. I know
We
every
have a
state's
fucking
different, and I'm assuming every one of my colleagues here have done the
titanium
math for
body.
their states, not focused on that. But I want
Like
you to
C3PO
destroy my
RoboCop.
estimates if they're in fact wrong, and I want you to acknowledge them if in fact they're right. That will come into question as well. Mr. Kennedy, you've stated multiple times in response to other members' questions that scientists were lying. We'll go back to the record in cases where you've said that. I'd just
Stop
like
the
to see the
cap.
scientific evidence to substantiate that. I'm going to stipulate that you were honest and you had research behind it. We'll go back and figure out what scientific studies you believe are founded on lies and not scientifically viable. And then finally, I just want to give you an opportunity. Apparently, in the exchange with Senator Bennett, you said you agreed with Dr. Levy's statements, who said that the mRNA vaccine caused serious harm, including death, particularly in young people. They said you agreed with that comment. Did you agree with that comment or not?
I think that's true, yes.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Mr. Tillis. We now have Senator Smith. You're recognized.
Thank you, Mr. Chair. So, Mr. Kennedy, I have sat here for the last many minutes and listened carefully to your testimony. And I think actually Senator Tillis laid out so many of the ways that what you have said has contradicted yourself and others. It's, I don't even know where to start. So I'm going to start here. Over the last 8 months, you have claimed to make America healthy again. But in actual fact, you have led the charge in the Trump administration to destroy what is best in our healthcare system. And your denials and your evasion and your lies here do not change that. You
were
are
all
the
with her.
Secretary of the Health and Human Services. Yet you're trafficking in these fringe idea and discredited theories that are completely out of step with the scientific consensus. And you seem to be willing to say anything in the moment, even if it's untrue. So last time you were before Congress, Secretary Kennedy, you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary.
You said that on Joe Rogan.
Let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth. I mean, here's what I know. Here's what I
Want me to
know.
explain why, Senator? You just
No,
want to-
actually, I want you to listen to me.
Okay,
Yeah.
go ahead.
I want you to listen to me.
Yeah, you
'Cause I've been
listen
listening to
to
you.
you.
Fuck the hell off.
listen to
That
me.
ASIP is an independent panel after you stalked it with
Fuck the
your
hell
picks.
off.
You said that you want evidence-based science, but it seems that what you mean
You sound just
is
like you.
evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world. It's incredible. But let me move on. Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants.
That is offensive
You
to
have
witches
no
and
evidence
warlocks.
of that because you have no evidence of a connection. And you want to talk
I
about,
didn't, you're just saying something, you're just making stuff up.
you know, this is what you say, right?
No,
Secretary Kennedy, when
no,
someone
no.
presents you with information that does not fit.
I did not
your
blame that
world
shooting.
view,
I have no idea whether, I have no idea.
did.
And
You
I
did.
never said that. You're making it up.
I
You're
am not
twisting.
making-
Yeah, you are.
Bring the receipt.
Secretary
Bring the
Kennedy,
receipt.
Honest right
If you
now.
want to talk about mental health and gun
You're
violence
being
in this
dishonest.
country, if you want to talk about mental health and gun violence in this country, we should be talking about that because that's what the
Let's
parents
talk then,
of
Senator.
Annunciation School.
You don't want to talk.
wanna
You want
talk
to
about.
harangue and you want to politically, you want to have partisan politics.
That is,
I want to actually solve these problems.
Miss Secretary
Bullshit.
Kennedy,
Yeah.
what the Trump administration is doing right now is making it harder for people in this country to get access to mental health care. So don't talk to me about solving the mental health care crisis when you are making it harder. You cut Medicaid, which is the #1 payer for mental health care services in this country. You
That's what I'm
decimated
saying.
the agency, Health and Human Services, that focuses on mental health and substance abuse. That's what states count on. They're cutting their services to schools as a result of that. Several years ago, in a bipartisan way, Congress came together and passed the Safer Communities Act, which made important investments in mental health care and did some important, though small things to reduce access to guns. What do? You propose cutting that funding. This is what we're talking about in your leadership in the Department of Health and Human Services. If you want radical transparency, as you talk about, I mean, take a look at what you are doing. And, you know, I've heard a lot about MAHA today while we've been here. There's a lot of Americans, Secretary Kennedy, who trust you, who believe what you say, especially when you say you're standing up to corruption. And I think that
Oops.
Been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers that just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country.
No.
We had comparable levels.
There's only a few.
In the 60s, and people weren't doing that.
Afghanistan,
Something changed.
Oman,
It dramatically
Yemen.
changed human behavior. And one
Congo.
of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them.
Oh,
That
I mean,
part of suicide,
wow.
suicidal ideation. So
If-
we are doing those studies right now for the first time.
If only they were allowed to play clips in Congress. They could be like, this is what you said, Mr. Secretary.
You literally said it. You literally said it.
You literally said it.
I got 2 screens.
they need to know, you apparently have a lot of influence with President Trump. Did you ask him not to roll back these regulations that are stopping the big corporations from dumping heavy metals and endocrine disruptors into our soil and water? I mean, there's no evidence that you have been even opposing that. Did you do anything to stop the Trump administration
I'm
from
done with the
rolling back
environment.
this
Okay.
handout to big pharma that makes it easier for the big drug companies to charge more for cancer drugs? No, you presided over that. I mean, it's stunning, really, what's
is
happened
stunning.
over the last 8
I'm
months.
stunned as fuck.
It's stunning to me. And I just hope that in this moment, our colleagues, there's hardly anybody left in this room, are going to think about what it is that you've done, what
You don't
your
fire them all.
legacy is going to be at the Health and Human Services Agency. And pay attention to the damage that is being done here.
And I closed my all-in-one.
Senator Marshall,
All right. Thank you, Chairman, and welcome, Mr. Secretary.
I closed my
One of your
Windows
themes
Surface.
For the CDC is transparency.
Magnetic
And I
clip.
think when I hear you talk about transparency, I think part of that is sharing what you know, what the CDC knows with parents so that they can make decisions. Behind
Oh
me.
boy, what is this
Yeah, I know it's
chart?
gonna be hard to see from there. I can barely read it. This is the current CDC recommendations for vaccines for children. On day number 1, they get their first jab of hepatitis vaccine. By the time they're 18 months, they've had 18
here we
jabs.
go.
By the
Oh,
time
boy.
they get to be able to vote, they have 76 jabs.
Oh, man. 76 vaccines to
When we
protect you
talk-
from
when I listen,
76
what I hear
fucking
you say is that,
diseases.
Look, vaccines are drugs. We need a measured response and a measured, when do we use this? It's interesting.
Yeah, you sound like a real intellectual. They measured it. Shut the fuck up, fucking Farmer Gunther over here. Shut your dumb hick ass up. Shut up.
That the United States has put age 65 and older for COVID vaccine. UK has chosen 75 and France 80. Obviously, sciences disagree exactly when that should or shouldn't be. Hepatitis.
Sciences disagree. Shut up,
Yeah, come on, man.
stupid boy. Shut your dumb
B
mouth.
vaccine, it makes no
Your mouth
What
is
he just
dumb.
said disproves his own fucking point because he's like, oh, the UK, they have 71 and France, they have 80. Well, guess what? They still have around the same number. Like,
Who's
they're
right in-
disagreeing
who's
on
right in the
very
middle
few
there?
things.
Who's right in the middle? Like,
Yeah,
shut up.
yeah.
Shut up. Just shut your stupid Marshall,
sense
stupid
to me.
shut
I've
up.
only delivered 5,000 babies, but we do a hepatitis test on every mom. By the time she delivers that baby, I know her pretty well. And if she doesn't have any risk factors, if she's not an IV drug abuser, if she's in a stable monogamous relationship, nobody at home has hepatitis, I don't know. I don't see the
Chrissy
benefit.
makes a
of
point.
that
Some of those are
hepatitis
booster
vaccine. Everyone's
shots.
eligible
Right.
for it. Everyone can get it. And my pediatricians always agree with me. And no, I'm not
out.
saying if you don't know the hepatitis status of that patient, they shouldn't get it. I'm not saying if this person's had no prenatal care, that puts them at risk for hepatitis. Can you just speak a little bit, when you talk about transparency and trying to empower and make vaccines available, these should be treated just like a medication.
No.
I mean, you know, I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well,
He is.
I'm pro.
Yes.
Yes. We just saw the clip where he said we're over medicated, so that's why gun violence happens.
Like, medicine is not just tablets and pills. Like, is that what he thinks medicine is? Like, if you go to the pharmacy, you go to get medicine, and then everything at a pharmacy is medicine. You know what I mean? Does he think, like, you know, like with Trump, with his dumb fucking self, where he thinks tariffs mean something that is completely opposite of what they mean, and he's just running with the wrong definition. I think this dumbass is running the wrong definition on medicine, but he would know the difference between drugs and medicine if he actually went to fucking medical school.
He was actually a fucking doctor.
If
He's
he
not a
had
doctor.
Any medical training, maybe he would know that he can't just interchange those words. But he's dumb.
He's some fucking QAnon lunatic who did his own research.
Bro was drinking the blue milk extract on the plane. Everybody was like, what the fuck? Bro got antifreeze. He got windshield wiper fluid on the plane. This is the guy. Look at him. He looks great.
He probably thinks that Democrats are still eating adrenochrome or whatever.
Right. He a Kennedy. He a Kennedy. Let's crack open that black book from Epstein, shall we?
He's the worst Kennedy.
Some medicines harm people. Some of them have risks. Some of them have benefits that outweigh
friends
those
close,
risks
keep
for
your enemies
certain
closer.
populations. And the same is true with vaccines. And we don't understand the risk profile because vaccines are the only medical intervention, medical device, or pharmaceutical drug that are exempt from pre-licensing safety studies. And so there are 2 hepatitis vaccines. And one of them had a safety study that lasted for 4 days on 143 kids for a product that's going to be given to 76 million kids.
Yeah.
The risk profile prior to the introduction.
I don't have time to fact check that, but He made that up.
The vaccine, the risk of a baby dying from hepatitis.
Every time that he's quoted any number and we've looked it up, he's been off by like a factor of 5. Like every fucking time. Like he is always way off, or he's using like 2 of the wrong columns of a graph. I do not trust his worm-addled brain to remember and recall stats.
B was 1 in 7 million. That means you need to give 7 million hepatitis B vaccines to prevent 1 death if you're going to give 7 million.
So
That doesn't, oh my God, that doesn't, no, that's not how that works.
He's so stupid.
That's not how vaccines work.
He's so stupid. He doesn't know what it is. He doesn't know what a vaccine is. He doesn't know what a drug is. He doesn't know what medicine is.
Mikey,
he does not know.
I have no idea what the hell he's talking about.
It's about
you really are. You're really.
I literally have no idea what the hell he's talking about.
And look at the little like he does a lot of face reading to like get approval from people because he's a used car salesman slime ball. And there's like the showing of like it's such caveman behavior. I don't know how anyone wanted him to be the fucking president. They wanted him to be president, Tim, and we were the fucking bad guys. We were the bad guys.
Yeah. And then he hitched himself to fucking Trump's wagon, and Trump was like, I'm going to put him in charge of our healthcare system. That'll be good, right?
Everybody said, whoa.
Everyone was like, I don't know about that one. Can we put him in charge of something else?
They want
something he can't fuck up.
They wanted him to be presidente, al dente presidente.
Oh my God!
That means you need to
definitely. If RFK was a noodle, he'd be overcooked for sure.
He'd be a soggy noodle boy. Uh-oh.
Oh, we got a super chat from Allie.
Triggered by trap card.
I'm not a dictator.
Yes, you are.
5 British pounds.
Burn hole.
Just a question: how the hell is the U.S. going to get this fixed after this government is gone? Genuinely asking. I can see lots of kids dying.
Yeah. Unfortunately, I think there is going to be some fallout. But the old systems, people know how to do them, and those people are still around. But guess what? You're going to have to pay them out the ass to come back, and they're going to need guarantees that this shit doesn't happen again.
Yeah.
So they're going to want complete autonomy from all this shit. So, I mean, we might end up getting some federal workers some more protections once this is all over to get them out of the purview of the executive branch to prevent this shit. Because honestly, they shouldn't be able to fire these people.
Yeah. Yeah. Well, I mean,
it should go through the voters or something. Put them in districts and let the voters decide who their health person is or whatever.
Well, one thing that wasn't mentioned is after RFK or Trump, whoever fired that CDC director, a bunch of people resigned in protest. Like this has happened several times now, and getting those people back into government is going to be a task, but it's going to have to be done because there's a major brain drain going on in government right now. All the people that know what the fuck to do are leaving, and they have to get them back. Or
else it's going to grind to a halt. Like it's just not going to be able. The machine won't be able to run.
Yeah, in the 2028 Gavin Newsom administration, like they're going to have to figure out how to find and rehire all these people and give them some sort of promises saying we're not going to let you get fired again,
right?
Because we need competent people running government,
right?
Not this fucking guy.
The trains need to run on time, damn it, and they are fucking woo. They went from bullet train to them little rickety joints be on the mountain. 13 people hanging off the side. Yeah, that's kind of where we're at now.
However long RFK's tenure is in this administration is just going to be one disaster after another. He doesn't know what he's doing.
He has no good takes.
He fucking hired Dr. Oz. Like,
Dr. Oz is actually a doctor, but he's a heart surgeon.
Yeah.
Kind of stops there, guy. You're a heart surgeon. You're like, he has his own technique about like using this wire mesh thing. Friend of the show. Dr. Oz is one of like 11 people in America that could have operated on his heart. Like he is that dude when it comes to heart surgery. All this other woo shit and fucking drinking cabbage water and charging your moon crystals at night. No, the woo shit is kind of not it.
Let's just say he had a very questionable TV show and then a very questionable run for Pennsylvania Senate.
Yeah. Oh yeah, he lost to fucking Fetterman, right?
Yeah, he lost to Fetterman.
And then Fetterman had a stroke and then forgot whose team he was on. And was like, I live in Israel.
It's all been great. It's been a fun time.
Oh, Pennsylvania, you old chestnut.
To prevent one death if you're going to give $7 million.
So, Mr. Secretary, and I guess before the press labels me wrong,
I want to hear.
Give $7 million. Risk profile prior to the introduction of the vaccine, the risk of a baby dying from hepatitis B was 1 in 7 million. That means you need to give 7 million hepatitis B vaccines to prevent one death if you're going to give 7 million.
So, Mr. Secretary, and I guess before the press labels me wrong, I'm not anti-vaccine.
That is the dumbest thing I've ever heard in my life.
That is the dumbest
it's real
thing.
dumb. I was like, let me hear it again. No, it is savagely dumb, aggressively dumb.
Either. I think MMR has been a great vaccine. The DPT has been a great vaccine. Polio has been a great vaccine. Smallpox. So there are great, but it's the measured approach that we're after, the transparency. You're trying to empower parents here. What I feel the difference is sometimes my friends across the aisle feel like there's a one size fits all.
Person impersonator says, we are living through times future generations will be taught about as a cautionary tale. Assuming that they know how to write still.
It is so true that two things can be true, and I don't understand why just the rabbit hole some of my colleagues are going down. There's a big difference when I was out there practicing, doing volunteer work. I was so confused myself on the numbers, people dying with COVID versus from COVID. And we still don't have that message. And I think that's what I hear you saying as well. How many people died from COVID versus with COVID is a different answer. The situation today is so different when this monster virus was made at a laboratory in Wuhan, China, and none of us had ever seen this virus and we had no immunity to it. But today, every American's had COVID a dozen times probably, and we built up immunity. I think that's why both things are true. It was a miracle. Warp speed was a miracle. What President Trump and his team did, and it saved millions
Chrissy,
of lives.
because he's counting all the booster shots that someone would get over their entire like adolescence.
Both things are true. Anything else you want to clear up on the morbidity, mortality of COVID and COVID vaccines?
So
I
we'll
think
pause it for a second, Mikey.
Yep.
So RFK over here was saying that if you got hepatitis B, it was like 1 in 7 million people would die from it.
Mm-hmm.
So that's not even close to true. It's like 1 in 1,000 people would die from hepatitis B or a disease related to having hepatitis B. Like he's not factoring in chronic hepatitis, which 7% of people who get hepatitis B end up with liver damage, liver disease. It increases the mortality rate 13-fold and increases hazard of liver-related mortality compared to uninfected people by a factor of 13.
But they don't need that. They could just stay away from somebody who has hepatitis, so then they don't have to get this thing. And you can look at somebody and be like, what it do, and then use your brain power and be like, oh, you have hepatitis B. Oh, okay, I'll have to stay away from you. Like you can't see that.
So it's not 1 in 7 million.
It's Temu Lindsey Graham. Yo, should we? I don't want to talk about like a certain person being outed for being not the sexuality that their religion would dictate. I mean, I'm not going to talk. I'm not going to talk bad about Lindsey Graham. I'm not outing him because that's wrong.
Here's the adjusted mortality rate for hepatitis B. It's 0.5 deaths per 100,000 people. As a direct result of having hepatitis B. So for every 200,000 people who get hepatitis B, one person dies.
Yeah.
Not 1 in 7 million.
Tim, it's 1 in 7 million. Okay.
And if you count in the complications from having hepatitis B, it's higher. Chronic hepatitis will kill you fast.
Yeah, but 1 in 7 million.
The COVID vaccine was critical. President Trump's leadership got it to us when our society was locked down. It allowed us to open up. It was, as I said, perfectly matched to a virus that was new in the experience of humanity. And so it was a miracle.
As she says, infant mortality in U.S. was 32.5 deaths per 1,000 live births. Now it's around 5.5. In 2 years, it will be back up to double digits. That is as long as Trump's allowed the statistics to be counted. Well, yeah, that's the other part of it. Because the numbers, I mean, who the hell knows what's going to be what when it's full of sycophants using... Because the thing is, since the whistleblowers and all these people are getting rooted out and he's asking fucking loyalty questions, they may not use real shit. That's why they got to get the loyalists out of there. The patriots, they got to get them out of there because they want to make up all the shit. Yeah. That's why I was like, oh, in September I'll have this thing. I'm going to tell you guys the definitive answer for the cause of autism in September. Yeah, because he's trying to get rid of these people, and then they can make up their own studies, and it can be a government study. You know what I mean? And it'll be complete bullshit because that's how they fucking live their life. If I'm not wrong, cheat.
Yeah.
Like Trump in golf. That's exactly why these motherfuckers hang out together, because they have the same mindset.
Hey, SG has been a member for 3 months. I'm gonna blank your blank.
No, Tim, down, Tim. Don't do it. Don't do it. Oh. And again, all these Republicans are gonna have to sell this bullshit.
Yeah.
All this nonsense that he's doing, and then these kids are gonna start showing up sick. They're gonna say, "Turn it back to the way it was." Right. I can't. The hell you can't will be the response.
Right.
You can and will.
Right now, we're dealing with completely different circumstances where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different and it's complicated.
Herd immunity from the what? Say the word, bitch.
From the vaccine.
You dumb motherfucker. That's how it works. You almost can connect the wires, but there's like a brain worm in the way, and you just can't get that thought across the brain worm.
Natural immunity? You know how many people had to die for fucking natural immunity?
And you know how many times the fucking virus mutated because it went through. I mean, every time it clones is a roll of D20.
Yeah.
And how many cells are in a person? And then how many people got sick? That's a lot of fucking D20s. So that's why you have to stamp that shit out.
From what I remember from when we were all learning about COVID, the natural immunity to COVID only lasted 6 months. And then you weren't immune anymore. Because
it was different again.
Yeah. So fuck that, man. It doesn't last forever.
Fucking cooler trucks in New York City. Refrigerated trailers for the fucking bodies. And the fucking horrors that our medical staff had to go through, which we still haven't recovered from. Those people haven't come back. A lot of them are done.
Yeah.
After going through COVID, they're finished. No more nurses. They're fucking out of here. I'm going to be a nurse practitioner, and I'm going to go chill in this clinic over here. Fucking too hot in the ER.
And, if you just want to turn everything into a soundbite, it makes it, you can't have a grown-up conversation.
And also, like we said the other day, he needs to be in charge of Trump's healthcare. Just saying.
Yes, I'll put him in charge of Trump's healthcare. That'd be fine with me.
He needs to be directly over the cabinet and oversee their physician. Keys to the cabinet. Mikey and Tim, does ROK have the keys to the cabinet that holds at least one of the 2 stores of smallpox? Could he release it? No, I think that's held by who's in charge of that? Because we have a seed vault.
Yeah,
and we have probably National Science Foundation, so they might be. They might be in custody of like that kind of stuff for our science wings, but it might just belong to like the lab. It might just be theirs, like their bubonic plague.
He's just bad, and it's starting to pop up on all the news sites that he's just spreading vaccine disinformation during this congressional hearing.
Yeah,
he got rather sassy with someone else I saw.
Who is the person they were talking about before? Bennett? Where Bennett?
Oh,
at?
it was Cassidy. It was Bill Cassidy.
Yeah. What's he look like? White guy?
Old white guy.
Crapo? You gotta change your name, man. You can't let them call you Crapo. Wyden. Come on.
Where's Cassidy?
Look at.
Oh, it might have been that guy.
Look at Grassley. Look at Grassley over here.
Chuck Grassley.
Wheeled him in there. I know I've been there. Oh, there he is, Bennett. All right, let's go back. There it is. Thank you. Thank you for your donation.
You've activated my trap card.
You triggered my trap card.
It's like Pokemon.
You gotta catch them all.
In June, you fired every member. Mr. Secretary, Mr. Secretary.
He not even paying attention.
He's not even fucking paying attention.
Why is she up in his
going on?
Why is she up in his ear?
Does Congress have the power to fucking fire this guy? Like, can they impeach him, please? I think there's enough senators who are upset about this, so we could just go through that process. I'd be fine with that.
Like he's drinking his fucking Starbucks chit chat. Like he is not taking this shit seriously at all.
Science.
Senator Bennett. Mr. Secretary, in June, you fired every member. Mr. Secretary, Mr. Secretary, may I have my time back?
Pay the fuck attention.
Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA vaccine. So he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware
he said
another
what?
one of these new?
Yo, get him out of here.
Dude, this guy
Get him.
needs to go. He needs to go. He said what? Oh, I get this. I get this. This is the pseudoscience that like black people's bodies are different than white people's bodies, and they can handle pain better, and their immune systems are different, and all that stuff, right?
He's doing fucking what is it?
Man, he's doing eugenics.
Eugenics and like race science or whatever.
Jesus Christ.
Yo, get him the yo.
And
the number of black people that was over here like IFK is Bobby go look at what Bobby all right, man. Y'all keep fucking with Bobby if y'all want to.
And I'm 100% sure those are thoughts and things he said before he ran for president.
That's crazy.
That is straight up eugenics.
They wanted him to be president, Tim.
Fuck, man. Fuck.
Like we dodged a missile to get hit by a meteorite. Like it's just like this motherfucker is a straight up Scud missile towards civilization.
Members, Dr. Levy wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people. Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? God. It's not true. It wasn't true when he said it. It is not true when you said it. Secretary Kennedy, later this month, your new panel.
Why didn't they do this on the first go round?
I think they did, and he fucking lied his ass off, and now he
the
doesn't
Republicans
care.
Too.
Yeah, well, the Republicans fucking...
They were over there kissing his ass, talking about French fries are going to be so tasty again. I love me some beef tallow. Boy, howdy. I don't know what
you guys like shake and steak.
We'll meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine.
All right, I got to tell you something funny.
All right.
So I was out playing, what was I playing? I think I was playing guitar or whatever. It was after band practice. And we met up with some friends that were done playing like volleyball. I think it was like 2008, 2006, 7, something like that. What a great summer, you know. I'm like 21, you know, so we had to go to like the grocery store. We were going to buy something, maybe liquor. I don't know. But then I dropped people off at the door and I said, hey, I'm going to go park my van. I had the Red Rocket back then. I had a Pontiac Transport. Red. Awesome. Sick car. Best car ever. So dangerous. I'm so glad it's gone. But I went to Steak and Shake. I fucking parked the car like 3 lots over and fucking sprinted back over. So then when we came out, everybody was like, where's the car? And I'm like, is that it way down there? And we had to walk back with the groceries. I didn't plan that out all the way, but
that's funny.
It triggered a memory. Don't go to Steak and Shake with me. I'm an asshole.
For measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator.
The obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So,
well, it's a panel you just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
He's like snorting into.
Yeah, I know. It's gross.
God, dude, that's the worst guy in fucking Call of Duty, man. The fucking dude with his fucking mouth, his mouth right on top of his goddamn microphone.
He's got that PlayStation 5 fucking controller that has the worst microphone ever, and he's all up in it. Yeah.
What'd you say, man?
The pharmaceutical paradigm.
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
He wasn't listening.
I think that parents should be free
I know you said that before. I do too.
to make their own choices.
So will they be just as free after these?
I assume they will be.
I assume.
I will hold you to that, Secretary Kennedy, because this is not a podcast. It is the American people's health that's on the line here.
And I hope MAGA kind of understands this. Like when they're watching these clips and shit, and I doubt we're going to get into their algorithm, but send this to them. I'll clip it up and you can send this to them or whatever. This is not a reality TV show. Like this isn't like going to be, oh, let's see what happens next season. Like, no, this is kids getting sick. Like this is the fight for it. This is the argument for it. And people are having that argument right now, whether or not the kids are about to get sicker. That's right. This is the actual argument that's happening. I know it seems like this stuff happens behind closed doors. No, we brought it to the front door. Politics has hit the main stage. This is real.
This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described
Senator,
moving the Titanic.
Are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
Excuse you?
I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked you a
Kennedy.
question.
I'm asking the questions for Mr. Kennedy.
You're not the senator, bro.
Yeah, you never won an election, brother. Remember? Remember you lost.
You're evading the question. I would be like, go fuck yourself, buddy. Well, fuck the hell off.
Schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Oh, go fuck yourself, buddy. Well, fuck the hell off. Yeah.
Senator
Fuck the hell off.
Tell him, Tim.
I'll try and restore a little calm here. And I'm approaching this.
I'm going to
as a
blank your
doctor,
blank.
not as a
There'll be
senator.
no calm.
I am concerned about children's health, seniors'
Yo,
health.
get your head out
all
the
our
way.
health.
Don't move
And
your
I
head.
applaud you for joining the
move
president
your
in
camera.
a call for radical transparency.
There we go.
Thank you for that.
You see that?
And the president in a call for radical transparency.
Hey.
Thank you for that.
Get the fuck out the way.
I said yes. I believe it. That President Trump deserves a Nobel Prize for Operation Warp
Oh, here's
Speed.
Cassidy.
If he'd been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars. We reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That
So
was phenomenal.
let me ask you.
Oh, come on.
That you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Oh, man.
Wait, that was a statement.
I did not say that.
Okay, then let me ask, because you also.
Fucking Bronco.
Senator, I just want to be clear. I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine.
He breathed
Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. But let me ask.
I'm happy to explain why.
I had 3 minutes and 30 seconds left. It also surprises me.
Well said, when
you canceled, or HHS did, but apparently under your direction, $500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems just to cancel. It seems like an incredible waste of money, but it also seems like a commentary upon what the president was attempting, what the president did in Operation Warp Speed, which is to create a platform by which to create vaccines. So this just seems inconsistent that you would agree with me the president deserves a tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this the speech that you don't want me to answer? Because I want to answer that question.
Please.
Wow.
Be tight, please.
First of all, the reason that
his coffee has worn off. Y'all are harshing his buzz. He sunned his butthole this morning, and you're wasting his chakra right now. He said, "Let me explain to you."
He's so pissy.
Yeah, he's not. He doesn't like this early morning shit.
This is the speech that you don't want me to answer, because I want to answer that question.
Please.
If it's a question.
But be tight, please.
First of all, the reason that Operation Warp Speed was genius is it did something nobody had ever been done. I don't think any president but President Trump could do it. It got the vaccine to market that was perfectly matched to the virus at that time when it was badly needed, because there was low natural immunity and there were people getting very badly injured by COVID. But it was also brought in therapeutics like hydroxychloroquine and ivermectin and protocols for treatment.
Did you just say ivermectin?
And there were no mandates.
And hydroxychloroquine.
Oh my God.
Another question, so please.
That's when I began litigating against President Biden's mandates. Now,
I'm sorry, let me go on because
in terms
you've
of
covered
me
the mandates
canceling those
before.
contracts,
I have limited time, Mr. Secretary. I'm sorry. You've called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest.
Oh boy.
I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP and the Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board. Excuse me. Can I have my time back?
Yes.
Yeah.
I'm reclaiming my time.
About is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers. Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science. If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
no, I don't. It may be a bias, and that bias, if disclosed, is okay. But it's not a financial. It's not a financial conflict. It's not a financial.
Let me finish up. Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID. This is from Eric Erickson, good conservative out of Atlanta, Georgia. Occasionally gives me hell.
Uh-oh.
My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now, even for patients over 65, creating a huge headache.
I
submit
did
these for
this.
the record.
Why can't you?
I would say effectively we're denying people vaccine.
Senator Cantwell.
Why?
You hate to see it happen.
Yo, that was a bloodbath.
Why can't you? 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 Well, I did.